and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. Now, as India waits with bated breath for the vaccination process to begin, there seems to be a war of vaccines that has now emerged. The two approved vaccines for emergency use, that's Serum Institute produced that has made Covishield, and Bharat Biotech produced Covaxin. So, on FYI, we thought let's do a head-to-head comparison. So India now has not one but two vaccines. The question, however, is how are they different from each other? Is one better than the other? And given a choice, which one should you get? For this, let's do a head-to-head comparison of the two. It's Oxford versus Bharat Biotech. That's Covishield versus Covaxin. Now, to begin with, Bharat Biotech is an indigenous vaccine, completely made in India. India's top scientists from the National Institute of Virology and the ICMR have worked tirelessly on its technology. And Bharat Biotech, a Hyderabad-based pharma company, is going to manufacture it. Now, Oxford, on the other hand, while not made in India, will be manufactured in India. Oxford AstraZeneca, as the name suggests, was built by scientists in the Oxford University. AstraZeneca is their production partner. And the India element here is that Serum Institute of India, that's the Poonawallas, have got the license to manufacture it here in the country. Now, apart from that, both are two-dose vaccines. Both can be stored in refrigerator temperatures, which makes it storage friendly as well. But when it comes to efficacy, that's the big controversial question. While Oxford has been tested for an efficacy of 70%, Bharat Biotech's efficacy is still unknown. Though the internal assessment of the vaccine in phase 1 and phase 2 of the trial shows that it is effective by about 60%. However, it is not a dependable data as it has not been peer reviewed, and the actual efficacy can only be known after phase 3 trials complete. Trials which are another major differentiator between the two. While Oxford has done around 40,000 trials across the globe through the course of its 3 phases, Bharat Biotech has tested vaccines only on about 25,800 people. In fact, they are struggling at this point to get more volunteers to complete phase 3. Now, let's move on to the technology. Bharat Biotech shot is an inactivated vaccine, meaning the scientists at the NIV identified the India strain of the virus and figured out that if you induce that inactivated or dead virus in the body, our body then mimics the strain and develops antibodies against COVID-19. It's like how, imagine, one gets COVID and then antibodies come in. This is the same procedure without actually getting it with a shot. On the other hand, Oxford shot is a viral vector vaccine. The virus that causes chimpanzees to get the common cold is altered to make it look like COVID, and because it looks like coronavirus, the body's immune system then begins to produce antibodies and T cells to fight it. Apart from that, there is also a major differentiator in price, which again Bharat Biotech has not been very clear with, but their head does go on to say that it will be as cheap as a bottle of water. Sonal Mehrotra Kapoor, NDTV. All right, so now that you've understood what exactly are the differences between the two vaccines, let's throw it open to our guest this evening. We've got Dr. Sunila Garg, advisor to ICMR, somebody who's worked very actively on these vaccines as well. Dr. Puneet Mishra is a professor at the Center of Community Medicine at AIIMS. He's a WHO fellow as well. Thanks for joining us today. We also have Dr. Harman Singh, he's the director for AIIMS Bhopal, and Dr. Prasoon Chatterjee, associate professor for geriatrics medicine at AIIMS. Let me begin by giving Dr. Sunila Garg the first comment here. Dr. Garg, let me just off the bat ask you the most obvious question at this point. When it comes to the effectiveness of the vaccine, how do you think at the moment Bharat Biotech fares against the one developed and will be produced by Serum Institute?
You see, let me first bring it to your attention that all the 3 vaccines, whether we talk of Pfizer, Moderna, AstraZeneca, those vaccines also have not gone into phase 4, where we will know the actual effectivity of the vaccine. But you see, when we look at the Bharat Biotech vaccine also, when you talked about the number of volunteers and all, 25,000 is not a small number when we talk of phase 1, phase 2 and phase 3 of the trial. In fact, you know, for all the phases, we have looked at the safety of the trial, we have looked at the immunogenicity of the trial, and we are also looking at the seroconversion part. That means till how long the the antibodies are staying. So that means efficacy as of the initial, this thing is also more than 60%, which is there. So that is where we, and then another part which is there is that it is very safe. We have not got any major side effects apart from, you know, pain, or it can be, you know, little fever which subsides in 24 hours. So that is my first reaction to this.
Right.
So I feel that, you know, the vaccine is fairly comparable to all the other vaccines. It is, and it is also a emergency use backup vaccine. By the time we
Right, but Dr. Garg, what I'm trying to understand from you, if you take a pause and listen to my question, please,
vaccine as for
my question is in two folds. One, at this point, nobody is questioning that it's not safe. The question here is it effective? That's number one. And second, isn't it true, Dr. Garg, at this point, that Bharat Biotech and ICMR is struggling to get volunteers to try and actually complete its phase 3 trials? All right, I'm not sure if Dr. Garg managed to listen to that question. Let me take it to Dr. Prasoon Chatterjee over there.
I can hear you now.
Your
I
first...
can hear you.
All right, a bit of delay over there. Let me bring in Dr. Prasoon Chatterjee over there. Your thoughts, sir, when it comes to the effectiveness of both the vaccines? Dr. Chatterjee? All right, not getting through that one as well. Let me try my luck with Dr. Puneet Mishra now, if you can hear me, sir.
Yes, yes.
All right,
yeah.
Good. So can you answer that question for us? A lot of concern over how effective the Bharat Biotech vaccine is going to be. We saw very combative press conference in the CEO as well. What are your thoughts?
I haven't seen the press conference, but yeah, definitely in your show I could hear a few of the arguments. Let me explain it in little detail and simple language so that your viewers, they can understand what we are talking about when we talk about the effectiveness of the vaccine. Actually, what happens that first of all, when we do in humans, it is a phase 1 trial, which is mainly the safety trials, and in the phase 2, we do the immunogenicity. So what happens in the phase 2 trials, we take the healthy volunteers for the vaccine and we inject the vaccine doses and see the production of antibody and the response of how much antibody it is produced. We see the neutralizing antibody. So basically, we see what is the increase in the titer of the antibodies, through which we know, okay, this vaccine, whether it is capable of producing the enough antibodies so that it can protect.
And what happens in phase 3?
Yeah, so I'm coming to that. So this is up to phase 2. So Bharat Biotech, they have completed phase 2 data and it has shown that it is producing neutralizing antibodies in sufficient amount which is required to prevent the infection. Now what happens in phase 1 and phase 2, we take the healthy volunteers because risk is more. And when it comes to phase 3, we do large scale trial and the real conditions. So in this trial, we take everyone from the public, whether you are with comorbid condition or you are elderly, so different age group and near normal condition we try to take. So that kind of
which for Bharat Biotech has not been established yet. So are you saying it is not appropriate to go ahead with it even with emergency use?
Give me 2 minutes time. Let me explain. Let me complete and then I'll answer the new question which you have posed to me. So what happens in the phase 3 trial, what they are doing? See, here they have seen the immunogenicity, but for the phase 3, all the vaccine manufacturers, what they are doing, they are giving vaccine and placebo to those who participated in the trial. And they see when a definite number of people there, they develop, COVID, they come COVID positive from that population, then they see what percentage of people were positive in the experimental group versus placebo group. So that's what's happening, and that is going on for Bharat Biotech vaccine. Now your question is, will you repeat the last question you have asked?
Right. I'm trying to understand, so since that very crucial third phase has not completed for Bharat Biotech and the fact that they are struggling to get even volunteers to do that at the moment, how do you think, or what in your opinion, is it okay to have a vaccine like that rolled out?
Yes, see, this is emergency use authorization. We are struggling in the sense that it is a situation of pandemic. So at the pandemic time, we have to get the vaccine, and till now, whatever evidence we have, they are robust evidence, which is proving that yes, it is giving the immunity. So that kind of information we have already got. If you talk about, say, for example, the Serum Institute vaccine, we don't know how it is behaving in the Indian population for that matter. So whatever evidence we have, we are working with that evidence till the time more evidence are coming up. So I feel the evidence
let me hold you there. Isn't it true that ICMR has actually aided the Serum Institute to conduct trials here in India as well?
They have conducted
trials. Yeah, so that's happened.
No, but how many people they have enrolled here? And the other thing is, I think the result for the phase 3 trial for the Serum Institute in India, probably they are awaited because I haven't seen the report. So I am not questioning Serum Institute or Bharat Biotech. What I am saying, in the pandemic situation, the emergency use authorization of both the vaccine, I think they are
okay, I get your point. Okay, I get your point. Let me bring in Dr. Singh now. He's the director at AIIMS Bhopal, also a very senior virologist in the country. Thank you so much, sir, for patiently waiting for your turn. I just wanted to understand from you, I want to move away from efficacy at the moment because so much has been talked about it already. Just purely on the basis of tech, because that is also so different in the two vaccines if you see. How do you think one weighs against the other?
I think this is a very pertinent question, and let me tell you, because even though Bharat Biotech data is, I was listening, which is your valid question, but before that, the technology part is concerned, this similar technology, inactivated virus, has been used in China since last 6 months. They started in May, Sinovac is the company, so they started this trial, and November issue of Lancet, they have already published it, and the efficacy has been found around 83%, to be very precise, after 2 doses. So that, and the neutralizing antibodies, they saw that this was very, very, significant number, so about 95%. The technology which has been used by the Bharat Biotech is same as used by Sinovac, that is inactivated virus, chemically inactivated by beta-propiolactone, which is a chemical. So they inactivate the virus, the whole virus is there, all, skeleton of the virus and the spike protein and everything is there. So the whole inactivated virus is injected, and what they found that if you give 3 microgram or 6 microgram, obviously 6 microgram was obviously it is a little higher dose. So then it was 83%, and when it was given about 3 microgram dose, then it was about 70%. So taking the analogy of the Sinovac company, which China has already published the data and they are using it for last 6 months. So I think the safety is not a concern, and the efficacy, on the same lines should be somewhere about 70 to 80%. The burst come, burst out. Now, coming to your probably the previous question, if I can chip in.
Please go ahead. Yeah.
It is true that phase 3 data is not in public domain, but we also know that hydroxyquinoline, ivermectin, favipiravir, all these drugs were also used without clinical trial. They were not, RCTs were not done.
That's true.
And ultimately they were also found to be, not of much significance. So in emergency situation, this kind of things do happen. The safety is most important, so that, even if it is not effective, no volunteer or patient should die or should have major side effects, which are, lifelong paralyzing or something like that. Even if there are some minor things, fever or pain, I think on the line of, ivermectin or the hydroxyquinoline or other drugs, they were used left and right, and, everybody,
prescribed by governments actually.
So I think that way we can justify this, licensing.
All right, that's very important point there being made. Let me quickly try and see if Dr. Garg can hear me. Ma'am, can you this time?
Yes, I can hear you.
Okay, great.
I can hear you.
All right, great. So, Dr. Garg, is it true at this point that Bharat Biotech is struggling to get volunteers for stage 3?
You see, if you were to ask me, if we have to recruit 27,000 volunteers, which is a huge number, and we have been able to get 23,000 volunteers against the whole thing that vaccine is going to come very soon, I think 23,000 itself is a large number. And we are taking the individuals from 12 years onwards, as has been mentioned, and we are taking comorbid individuals. The data is sufficient to provide, as against, the other.
But why isn't it public knowledge then?
It is, basically the whole data will come very soon in the public domain, because we have to just wait for a month so that we complete this phase 3 trial. And in the meanwhile, we have another drug which is already there. We have got 60 million doses of Serum Institute of India without, putting any repercussions. We have to go in a scientific manner that this is the first drug which we will be utilizing as soon as Bharat Biotech is available, because no one drug is going to meet the needs of the country. That is one thing which we have to understand.
Absolutely.
So there will be not even that, maybe that these 2 drugs may not even suffice. We may need a third drug as well.
Right.
So we have to behave in a very, or understand it in a very scientific manner.
Right. Right. On that note, let me quickly slip into a break. When we come back, we'll talk about a point that Dr. Garg has also raised, which has now become a bit of a controversy about using kids above 12 and children, them being used in these trials. Is it good? Is it bad? Is it a general template used for all vaccines? We'll talk about that on the other side of this very quick break. Stay tuned. You're watching FYI. Welcome back. You're watching FYI, where we are discussing and almost taking head-to-head comparison of how does Bharat Biotech stand against the Serum Institute vaccine. We've got the experts best in the country to sort of take us through that as well. Let me come to Dr. Singh and talk about this angle that has come up now. Dr. Singh, lots have been said today about the fact that children above 12 years of age have also been used in the course of these trials. Is that standard practice, or is this new, and should we be concerned?
I think usually this was earlier, this was not the objective of this vaccine, but recently what happened that, new strain which emerged and which has reached India also. And right now there is no vaccine which has been tried in the children less than 16 years. Or the pregnant woman or something like that. And this strain has been found to be equally infectious to children also, as against the previous strain, which was wild strain, we can say. So probably considering that, the technical experts must have advised the Covaxin Bharat Biotech product that they should include this group also, so that in future, if these children can also be vaccinated. So that may be the changed strategy, which probably they might have not thought earlier. But now this is with the consideration that new strain is more infectious in all population, including the children. So that may be the reason that they have included
that Bharat Biotech in that way has sort of an edge, because they have been able to test it over Serum Institute. Serum Institute has not done it on kids above 12, right? So that way Bharat Biotech is actually at an advantage here. Is that correct to say?
Yes, exactly. You
all right.
Absolutely
let me bring in Dr. Sunila Garg on this as well. Is that the reason why, ma'am?
Yes, because you see, now since we have got mutated virus with mutation, and which has shown that this mutant virus can affect children, infect children as well. So I think in long run this will be a better option, because by that time we would have conducted the trials and we would have known the safety, immunogenicity and efficacy in children as well. So this is a very plus point of this vaccine. And right now we have to think, in a very broad manner as to, because we do not know how this virus is going to behave in future in terms of infectivity. Till today, we have got, 34 individuals who have found to be affected with different mutant strains. And the plus part is that they are going to, or rather I'll say the important part is that they are going to infect children. So then we will need a vaccine which is going to, protect children also. And we also know as of today from our knowledge that children get infection, they get cured easily, but they pass off the infection. So when we have a vaccine which is effective in children, that will be an edge over other vaccines.
Right. So actually that's new piece of information coming in. Thanks for clarifying that. I have last few minutes, but I want to give a word to Dr. Chatterjee. And let me put you in the spot here, sir. If you had a choice of both the vaccines being available to you, you had Bharat Biotech and you had Serum Institute, which one could you go for?
Very difficult question to answer, but I can tell you one thing: immunogenicity is important, which has been proven through both the vaccine. And no vaccine is going to give us 100% immunity against any infection. In fact, even we give pneumovac, we give flu vaccine. So purpose is here that some immunogenicity should be there with you, as well as you continue your COVID behavior. That is very, very important. Both the vaccine has proven that they amount good amount of immunogenicity. Regarding safety also, both of them has worked. Only thing is what you are discussing throughout the things, that we need to continue the phase 3 trial for biotech, which is pending, but which will be done soon. I feel both the vaccine are safe, and there is no confusion on that. That is very, very important. I'll be happy to get both the things. Any of these two, I'm happy to get it. Thank you.
All right, then we leave it there for the moment. Thank you so much, doctors, for joining us on FYI. It's been quite an sort of enlightening discussion over here to understand the comparison between the two. Well, that's it on FYI today. You can catch us again on new timings. Now we'll be coming to you at 7:30 in the evening and 11:30 in the morning. Bye for now.